As the population ages, clinicians will be caring for an increasing number of older adults with cancer. We know that geriatric assessments can improve outcomes for patients with cancer, but how do we, as busy clinicians, perform the key elements of a geriatric assessment? In this video, we will introduce how to conduct a geriatric assessment, tools we recommend you use for each domain, and demonstrate that this can be done within 10 minutes. The ASCO Geriatric Oncology Guideline recommends including an assessment of functional status, psychological status, including both depression and anxiety, social support, and comorbidities as part of all geriatric assessments. There are several tools that can be used for each domain, and it can be hard to identify a tool for each. Therefore, we recommend using tools in the Practical Geriatric Assessment developed by ASCO. The Practical Geriatric Assessment uses questions about daily activities and physical function, tools to assess and screen for anxiety and depression, a standardized tool to assess comorbidity, survey questions to detail available social support, cancer and aging research group toxicity tool to assess the risk of chemotherapy toxicities, and questions about falls, sensory impairments, and weight loss. There are parts of the geriatric assessment that can be done before the patient even comes to the clinic, saving time. Forms can be sent to the patient electronically or by mail, and patients or caregivers can fill out the forms before the clinic visit. Also, they could be completed while in the waiting room. Assessments can be completed prior to the visit, include self-reported items on function, comorbidities, falls, mental health, and social support. Self-reported geriatric assessment tools can give the healthcare team essential information regarding an older adult's current health status, which can in turn be used to tailor treatment or to start interventions. Now that the patient or caregiver has completed their portion of the practical geriatric assessment, the provider will need to assess the following, and all of it can be done in a few minutes. Cognition can be assessed with several tools. The mini-cog requires asking the patient to remember and repeat 3 words and then to draw a clock on a blank piece of paper. Detailed instructions can be found on ASCO's website. Gait speed also needs to be assessed. Walking speed or gait speed requires 4 meters of space, and the patient is asked to walk at their usual pace and is timed. We have now conducted a practical but in-depth review of relevant geriatric assessment domains that can aid decision-making and guide interventions in older adults with cancer. Through analysis of our patients' answers to the self-administered tools and the result of our in-office assessments, we can determine whether our patient has any vulnerabilities. Now we can plan for the implementation of interventions aimed at solving or mitigating those deficits, including nutrition, physical or occupational therapy, home health, referral to mental health services, and medication deprescribing, among many others. We can also use the results of the Practical Geriatric Assessment to calculate the scores of important online tools. These scores provide a prediction of complications, chemotherapy toxicities, and even mortality. With the use of these tools, we can have better discussions with our patients and their care partners about the benefits and risk of treatment. We can even tailor dosing and follow-up schedules. Conducting a practical geriatric assessment can allow us to personalize cancer care in a truly patient-centered manner, and all of this can be done in less than 10 minutes. The results of the geriatric assessment should be shared with the patient to build a treatment plan. To learn what to do with the results, please watch What to Do with the Results of a Geriatric Assessment video. Thank you for watching.